Arigitani, clinical officers udomwe na mabithaa angi ya urigitani matikoretwo makiamukira marihi ma njoherera thutha wa marihi maya kurugamio ni kamitii ya kumurika micaara ya aruti a wira thirikari SRC. Umuthi ciama cia arigitani ikiure SRC gucokia marihi macio. Ciama ici ciugite ona thengia wao gukorwo makigeria uria marihi ma njoherera magukorwo magicokio gutiri undu ukoretwo ukihanika riu makiuga ni makinyite muthia.
The doctors, there is enhanced call allowance that was negotiated and is well prescribed in the CBA. We have every doctor working in the public facilities, those working in the referral hospitals enjoying this particular allowance. And then we have a number of doctors, over 80 of them, that are working in the Ministry of Health, where SRC has written a letter dated 27th of September declining on payment of that allowance to those particular doctors. So it's actually discriminating upon those doctors.
Kunyihio kwa njoherera ici ni gukoretwo kuri kihingisha kinene kuri arigitani guku makiure SRC wika mituki na kurekereria kigina kiria gifatie kunengerwo mabithaa urigitani.
SRC has continuously and consistently frustrated effort by the healthcare workers union such as KUKO, KMPDU and Kenan, among others, to engage, negotiate and conclude collective bargaining agreement.
As Katibu has said, the constitution is very clear. SRC is supposed to set for state officers advice for public officers. Now what they are doing, they are using the back door of the legal notice, and because we know this is what they have been looking for, to even set the salaries for the public officers.
Maya magithiaga na mbere kiama kia mirimu iria itagwatanagio manyitanire na kiama gia kumurika arwaru wa kansa ni maugite maundu maria matanyitwo gukuruhanio kandarathi ni njeru cia NHIF ni magukorwo makihinyiriria a Kenya aria mathiaga gwetha motungata ma mirimu iria itagwatanagio.
Public hospitals in Kenya are generally not adequately equipped and do not have the capacity to be the sole providers of healthcare to the rapidly increasing number of people with NCDs. NCD patients are often compelled to seek such services in faith-based or private hospitals.
Arugamireria ciama ici ni maugite ona thengia NHIF gwathwo ni Ministry ya ugima wa mwiri kugia na cikaro na thibitari cia andu kiumbe na ciama ici ritana riao gutire mundu rithikiriirie guku makiuria NHIF ukuruhania mendekithia mao kandarathi ni njeru gatagati ka NHIF na mathibitari. Girifotera Kameme TV returakoni wa Jiro wa Foro.